Hello, welcome to Neuropathology. I'd recommend that you have a firm grasp of neuroanatomy before embarking upon our lecture series together here in Neuropathology. We'll begin our topic by looking at stroke. The stroke itself, in general, as we go through the various categories, third leading cause of death. So it's no joke. Now, as we go through stroke, I'm going to give you some differentials, things that you want to keep in mind, as we've been doing throughout the entire course. Here, you want to be able to differentiate between a stroke versus a transient ischemic attack. And the reason for that is because the symptoms that the patient is going to present will be quite similar, won't they? However, the time course is extremely different. We'll talk about that in a second. Now, how did the stroke take place? How is there decreased blood supply taking place to the brain in which all of a sudden you've lost your functioning? Well, if it is transient ischemic attack, well, usually now define it as being stroke-like symptoms that last maybe approximately 15 minutes, maybe about an hour, maybe about 24 hours. But then the symptoms go away and the patient comes back to being normal. For example, a family, husband and wife, sitting in a living room watching TV, and they're watching their favorite show, maybe perhaps Full House. And all of a sudden, the husband is having a hard time with vision, having a hard time speaking, slurred speech, and really is having a hard time getting out of his recliner. The wife gets extremely concerned, and so therefore go to the doctor, and only to come to find out that in a very transient amount of time, maybe less than an hour, all the symptoms go away. That's transient ischemic attack. The symptoms are extremely similar to stroke, aren't they? But it goes away. However, what you need to keep in mind is that this is a risk factor for a stroke or impending stroke about to happen. And so therefore, you need to be quite aggressive with your patient to make sure that if it is a microemboli that is being set off into the circulation of the brain, that it has to be treated appropriately. The pathophys, now 85% of strokes that do occur are of ischemic nature, whereas 15% could be hemorrhagic, and therefore our time and your time should be focused upon ischemic, and then to make sure that we're complete, I'll give you a proper definition of a hemorrhagic stroke.